Members, I very much have enjoyed this debate that we've had today. It's unfortunately the first real debate we've had on health care, which has been the most imposing issue we probably have of the year. And I wish we were having these kind of discussions in committees. I wish the bills that were being proposed, that many of our members have brought up, had actually been debated. They'd been allowed to get out of the committee process, get to this floor, because you are exactly right. There are so many permutations of this issue. There are so many aspects of this issue that need to be addressed. Unfortunately, this debate is happening as the only debate in this House. And I'm hoping that will change today. I'm being optimistic, not realistic right now, because I know that it won't. It's going to pass out on a party line vote. This debate, in a large measure, is irrelevant, which is very, very sad. The fact of the matter is, Mr. Spitzer is exactly right. Many of us have done research on ERISA, and ERISA makes this plan illegal. I don't know how to say that any more clearly than that. It is illegal. A mandate on employers has been deemed to be illegal under all of these types of permutations and circumstances. That's the law. And I guess if everybody wants to pretend to fix health care, pretend to be caring about this issue, I guess that's what we can do all day, is pass out illegal bills and say that we've washed our hands, we walk away from this issue, because the concerns, members, on both sides of the aisle are real. This isn't some game. There really are a lot of things that need to be fixed in health care. The difficulty is that we're talking about apples and oranges, and they keep getting confused. One issue is the issue of the uninsured. The other issue is the issue of unaffordability. The uninsured folks, they are not one group of people. The uninsured in the state of California are several different groups of people. 2.5 million happen to be illegally here. That has created all kinds of conundrums for us. The federal government needs to solve this problem, but that's the status of things. Out of the 6.5 million spoken about, 2.5 million are illegally here under current law. We need to address that issue. I tried to bring forward a bill to address the issue. Unfortunately, nobody's wanting to talk about it, and I don't see a lot of relief from the federal side. The second issue is lack of access. Out of the 6.5 million people, 1 million have lack of access to care. Let's talk about how to get those people access to care. 2 million of this group, of the 6.5 million currently uninsured, are capable of buying insurance, yet just don't do so. They make $50,000 a year or more. They're not contributing to their care. There's something can be done about that. And the other million that is not included are 1 million people who are eligible for public programs currently but are not technically signed up because they don't get signed up until they go to the doctor. That's the reality, folks. That's what the real uninsured number is. But we're not addressing those as though they're unique issues that need to be sectored. We're addressing those as though they're just one amorphous giant population, and we're going to set up a giant bureaucracy to do it under this plan. This is the largest tax increase in the nation's history by any state. And the fact is that, members, I asked for alleged counsel opinion on the governor's plan, which under the same circumstances was cued by alleged counsel as a tax increase. A tax increase. And let's talk about what we're getting for that. The average small business doesn't make, this is average small business, doesn't make 4% of payroll profit. What are you going to do about that? When we had the discussion about SB 2, which only required people who employed 50 or more to be insured, that was going to cost us 70,000 jobs in the state of California. 70,000 people who not only don't have health care, they don't have a job. They don't have anything coming into their to provide for food or for rent or for anything else. And that was only when we had the line at 50,000. And that was several years ago, before we've grown by 600,000 per year. The fact of the matter is let me give you a little bit of context here. The size of the healthcare system in the state of California is roughly estimated at $190 billion a year. 190. To give you the in relative terms, the workers' comp system was $25 billion a year. This is 8 times the size of that. You're planning on putting in $5 billion new money in a $190 billion system. That's 3% increase of new money, and it's just going to solve everything. The fact is it won't solve hardly anything.
10 seconds.
We're shorting the Medi-Cal system by about $40 billion a year. Members, we can talk about rationing. We can talk about Canadians coming to California. We can talk about all kinds of inadequacies here, but this is a recipe for failure. Come back to the table. Let's talk about how to solve health care in California. This is the wrong way to do it.